one of the things that maybe we'll close on, she blamed this epidemic on obesity. And, I don't want to be too hard on her. Like, obviously, obesity does play a role in this MOSH syndrome, morbid obesity, secondary hypogonadism. There's no question. But she didn't say this explicitly, but what she's saying is essentially, if you would just lose weight, you could fix your testosterone. And I hear doctors say this all the time. Patients tell me that this is what their doctor said. They came in with low testosterone, but they said they didn't want to treat me because they wanted me to lose weight first. And they said if I just would lose weight, I could get my testosterone back up to normal range and I would feel better. Now, I partially agree with that. Generally, losing weight, especially losing body fat, fixing your lifestyle, almost universally will make you feel better to some extent. But this notion that you can correct especially objectively low testosterone levels by losing weight, we know is not true. And I want to show you guys one final slide here that I thought this was really just lays it out. And this is a review of testosterone levels in men who have lost a profound amount of weight after gastric bypass. So I know it's not men on TRT, obviously. This is not generally the population that we go through, but it really shows.
No, but it is a good population because
it is.
It is Roux-en-Y. There's a new procedure that's, I guess, single anastomosis is still the gold standard for morbid obesity.
Yes.
So patients lose 35% of their total body weight after a year. So yep. I think it is by far, in a way, the best weight loss intervention to look at in terms of
absolutely
the magnitude of your testosterone improvements.
It's a big one.
What do people think? Nowhere near as much.
Exactly, and that's exactly what this chart shows. And I drew this line in here because this is what came in the papers. This is in men who are age 40 or above who've had bariatric surgery, the majority of which are gastric sleeves, but they have Roux-en-Ys in there as well. And so what you can do with this, it's in nanomoles, so I had to do a little bit of math. But on the left side, you can look at their baseline BMI. I chose a BMI right about just shy of 40 because that's where some of the data is. And if you draw a line to where they end up a year later, you intersect and it will tell you what you can expect their testosterone levels to do. And so this is actually, I picked these BMI numbers because this is the average BMI change after 12 months post gastric sleeve. So you go from, on average, men from when a BMI like right around 40 to somewhere like right around 28. There's a lot of weight. So maybe it's 100 pounds of total body weight lost over 12 months. Look at this. So you get about 4.5 nanomoles. This is 129.9 nanograms per deciliter. So you can bump. So the literature says many men can normalize their testosterone after bariatric surgery. Well, yes, that's true. Yeah, if you're 250, we can get you up to 380. You might even get up to 400. That's not necessarily going to do you any benefit.
They
in terms
lose
of your
a ton
signs
of
and
muscle.
symptoms, right?
They also
lose yes, and that's not even talking about the muscle loss. Absolutely. So
well, it is true. Some other studies have shown that if you lose 20% of your body weight, you're going to gain about 200 or so nanograms per deciliter of testosterone levels. And if you're hypogonadal to begin with, 250, 300, that is not enough of an increase in testosterone to make a clinically significant difference.
No.
Now, granted, it's great that you lost 20% of your body weight. That is,
yes.
You need to do that. That's all healthy. You're much healthier, as you already said, Andrew. But as far as raising testosterone levels, it doesn't raise it enough to make a clinically significant difference. We know that from giving men that have testosterone levels of 250, giving them testosterone, raising it to 400 to 500, and showing that there's not a significant clinical benefit even doing that.
Exactly. But this is something I don't think physicians are aware of this data because I hear it so many times. If you just lose the weight, you're going to fix your testosterone problem. And it's just not, the data is very clear. That's just not the case. Will it get better? Okay, yeah, probably. You'll see a minuscule and clinically irrelevant increase in most cases. Now, there are outliers. I have seen guys who really take this lifestyle stuff to heart, and especially younger men in their 20s yeah, I've seen them have much bigger increases in testosterone, and good for them. And maybe in those cases, it can be enough to get them above that symptom threshold. But the vast majority of guys, especially post age 40, I'm sorry, it's just you're still hypogonadal. You're still hypogonadal, and you have the other health benefits of the weight loss, of course, but it's just not true that's going to necessarily fix your testosterone levels, or at least get you to the point where you're optimally healthy.